start by welcoming you to my YouTube series, High Risk, High Power. I'm Abby. I work with pregnant type 1s, and since getting diagnosed, I want to learn all about this high risk label, really. So I've been learning about this for the last few years, and I've got a wonderful midwife with me today, V. And I just want to say thank you for coming. And if you could just share a little bit about yourself and your journey, that would be really helpful.
Yes, hi. Thank you for having me here. My name is Vi, and I work in England. I'm based in Brighton, and I cover the southeast area. I started recently to work as an independent midwife 2 years ago, but I've been working for the NHS in the community setting, home birth setting for all the time that I've been here in England, basically. And I moved in 2013. Um, so that's
Very
it.
nice. Very nice. So it's over 2 years. That's really nice. Okay. So, so you've been practicing since 2009, practicing.
Yeah, as a midwife, yeah.
Okay, so
I
tell me.
graduate. I'm from Italy, so I graduated in Italy, but the system there is very difficult. And as soon as I graduated, I started working with some independent midwife. But as I was telling you, is a bit different there, and independent midwife are still seen as I don't know, witches and people who do, illegal things. And home birth there is it's very unpopular. Now it's changing a little bit, but at the time I thought I was spending a really long time trying to justify to the people around me and my friend and my family even what I was doing was not weird, or and that in other parts of the country, like in England, of Europe, like in England, home birth was a perfectly acceptable thing. So it was even recommended by the NICE guidelines. But so yeah, because I was spending all of this energy trying to maybe basically convince people around me that this work was good. I was too tired, and I said, I don't want to do this
Yeah.
anymore
Yes.
here. And so that's why I moved to England, because at the time, community midwifery and midwifery led community and home birth was really popular, and they were really trying to implement that into the
Oh,
system
wow.
because it was obviously beneficial,
Uh-huh.
as many studies have
Yeah.
highlighted that.
Yeah. And you knew
Um,
about that in Italy. You knew England is the place for home birth. It did.
yeah.
Oh, wow. Oh.
Yeah,
So tell
yeah.
me what has changed since 2009. So you've seen like a long time. What has mainly changed in the last in
So
your
I moved here in 2013, and at the time I moved, it was a time where all the birth center were built, just a little bit after that. And so, the first time I came, I went to visit Sam, and I was like, wow, this is amazing. I went to see the Barkentine one in London, and it was overlooking the river, and you have this amazing room, and just midwives in this place. But then if you need to be transferred, you can be transferred, and it was like dream. And I was like, wow. And then I worked in Cambridge as well, and they have a huge birth center there as well, like 10 rooms with huge room. Every room had a pool, the bath, lights and music and double bed, and even the equipment was all tucked in so you can not see anything medical around. And this because obviously home like environment has been shown to be
yeah.
promoting labor, and the outcome, if you feel, obviously you feel like you're in your house, and you feel like there's no medical things and equipment, and so obviously you feel less scared. Everybody, hospital is not normally a friendly environment,
Yeah, this
I
is
would
what we
say.
see. Yeah,
um,
exactly.
and so yeah, so that was great to see. But since then things have changed, and for some reason or another that we can never,
Mm.
well, I can never honestly understand. It's always based around budget and money, and they keep saying you see a lot of people, you hear a lot of people saying, "Oh, the system is broken," but it's not broken. They made it work really well for them, for the system. And so they are, every cut they do is all around physiology. They cut continuity, they cut, if there is a short of staff, they remove that from the home birth or from the birth center to prioritize the labor ward.
Wow.
Always.
Wow. And so you've seen
Lots
that
of,
in your time. You've seen lots
oh
of.
yeah, and then this more recently you can see all birth center shutting down because of shorter staff, home birth service suspended because they will always prioritize the people going to support the labor ward.
Oh my God. This is why your work is so important, by the way. This is why you
Yeah, and
good.
for myself, the reason I decided to be independent midwife is for my second birth. I was planning to have a home birth, and yeah, I had some people on call for me, and I was expecting. Obviously, you know, we don't have many privileges as NHS midwife, but we always had our midwife friends coming, you know, to our birth. But just after I went to maternity leave, they said to me, you know, even if the home birth service is suspended, generally, nobody will be able to come to your home birth, not even the people on call for you. So, you know, if they come, they will be in trouble.
Oh my,
And so I was like, okay, thanks, thanks for this.
oh my.
And so I think after the birth went fine. As usual, lots of things always,
Mm.
you know, works out themselves. And
Did you have it
so
at home? Did you have your?
yeah, the service was running at the time, so you know everything was fine. But you know, I had to think myself what other people think, you know, is going to be on or off.
Yeah.
What am I going to do if it's off? And do I have to stay by myself and free birth because there's no other option? I don't really want to go to the hospital, so I'm not going to go. And so that made me think about how lots of other people think and the option that they have. And when my son was born, after I was going to come back to maternity leave, we spent a lot of time in Bali during my maternity leave. And that was not the first time we go there. And every time we go there, there is a lot of thinking and things kind of, you know, you remind yourself about what you're here for and what is your mission in this life. And I was due to come back to from maternity leave to my NHS job. And I just thought, I don't know that I want that. Especially since I've been treated myself and seeing how they treat people, and they don't prioritize the client experience. They just, I don't know, they do things for themselves and their benefits.
Yeah.
And so I started to be doing this work this way.
Wow. So you didn't go back. You went straight into.
I went back because obviously you have to go back for some times
No.
after the maternity leave, and I'm still doing 18 hours with the community midwife team. So I do 2 days. One day I have a clinic, and one day I do visits, and sometimes I do cover home birth still. But again, so since even 2 years ago, things are even going worse. So I'm really hoping that I can live that soon.
But the women need you. You're like the shining.
You know, I mean, live the NHS. I know, you know, and that what has been making me think like, you know, some people cannot afford to have a private midwife, and so being part of the NHS will allow me to offer that to the people who are not able to access my other services. And we had some, you know, recently I had some, I attended some home birth, and the people who were there were really needed that. And so I was like, oh, it's so hard to just make this decision because, you know, when I do give the care, it's great care, and but also for myself and for my family. Sometimes you see we have to let go of things that don't work anymore and make more space for what we are really here for. And it might means that I would love to leave the NHS.
Yeah, so wise. Okay. So my next, do you work with a lot of women with that high risk? labeled high?
Yes, because within the NHS, obviously, when you have a booking, your
Ah,
uh, your your risks, which are not even risks, your
uh-huh.
basically your medical history or obstetric history is automatically embedded into this booking form, which means it says actually says risk and all the medical history and obstetric history. So
Uh-huh.
people often are labeled as high risk, and so that's why some people choose independent midwife to avoid this or to be seen as a whole person instead of a risk factor,
Yeah.
basically.
Yeah.
Yeah.
Okay,
And
so
so we do get often people with higher risk,
yeah,
which sometimes are not actually risk, but
yeah, yeah, exactly. So you would say there's more women that are high risk now because of reasons.
well, yeah, if you have anything, your history will be flagged up in
Mhm.
your booking appointment. But as I do have a clinic in the NHS, and you can decide whether you can going to classify that person on a red pathway, which is high risk,
Uh-huh.
or still you have some risk, but those risks are not actually affecting the pregnancy or the labor or things like that. And so
So
she
there's
might see a
levels.
doctor or have a conversation with them, but actually the pathway is still kind
Oh,
of low risk.
okay. I didn't know that. I thought high risk is high risk, but now that you're saying there's like levels of high risk.
Yeah. I would say that. Yeah.
Uh-huh. Okay, so
Um,
tell me, do you work with many women with type 1 diabetes?
um,
Or have you in the
not
past?
type 1. We have a lot of people with
Oh,
gestational diabetes, which is completely different. Um, Type 1, it's normally people with type 1 would not choose to have a home birth unless they're extremely educated and want to have a different experience in their life.
like me, I
Uh,
work with a home birth.
but I do know some midwives other independent midwives who have worked with type 1 diabetes and try to have a home birth. Yeah, and so it's like it's a different approach, and you approach the person as a whole person, and so you make decision together, and you don't just base your care on the guidelines. You just have a more open approach to what is going to happen, and if there is a problem, then we can act on that problem, but
Yeah,
we're not going to decide things
yeah,
now that you're at 12 weeks for when you're going to be into labor at what is going to happen then, because
right.
we don't know that. So
Amazing. That's so different because it's like, okay, on paper, type 1, you're going for C-section, induction, all of
yeah.
this. So that,
And even within our independent care, we can still collaborate with the hospital care and
uh-huh.
with a team. And in fact, that's how it should be all the time, really. Lots of people trying to work together as a team and seeing the person as a person so that we can give exceptional care
All
specific to
working
this person.
so good. Okay, so with gestational diabetes, so you've worked with women with gestational, and how is that? So what are the real risks with gestational? Do you know much?
Not very many. So,
Ah,
unfortunately, so gestational diabetes has been labeled gestational diabetes, but in fact, it's not diabetes, like in the sense of diabetes is, because it doesn't affect the whole body like type 1 diabetes or type 2 does.
uh-huh.
It's only related to the pregnancy. And
Yeah.
so when you're not pregnant anymore, you don't have that. And it's not systemic, it doesn't affect anything else apart from your glucose
Mhm.
and maybe your baby growth.
Uh-huh.
But the standards of this, when you're labeled gestational diabetes, are different in different
Yeah.
trusts, in
Yeah.
different parts of the world. Um, and sometimes even depending on the consultant, what they decide. That's show how difficult it is to label that, because nobody really knows how the glucose changes during your pregnancy. And
Mhm.
pregnancy is a state of intolerance to the glucose. That's why the test for diabetes is called glucose intolerance test.
Mhm.
And the most recent studies have shown that apart from the risk of the baby being bigger, if it's only gestational diabetes, there's no other risks involved in having
Mhm.
gestational diabetes.
Amazing, amazing information. And if the baby is bigger,
if the baby is bigger, again, shown, there've been studies recently. There was a big baby trial. It was called the Big Baby Trial,
Really?
which they it's been published recently, and the outcome of it was great because they basically had to stop this trial because there wasn't enough shoulder dystocia basically, and
Ah,
because all the babies that have been scanned in the uterus, most of them were not big. So
oh, wow.
you know,
Wow.
there's been shown that sometimes if you have an induction, you might have a little reduction of shoulder dystocia, but that study itself did not say that this is a good things to do
Uh-huh.
because the outcome is not
Right.
conclusive.
Uh-huh.
So
Because
at the moment, if you have a big baby, first of all, we don't know whether you're going to have one or not because the scans are really unreliable.
yeah,
Second of all, you might or might not have a shoulder dystocia. So,
right. And what happens if you do have shoulder dystocia?
so if you have shoulder dystocia, you can have a shoulder dystocia even if your baby is not big.
Yeah.
The shoulder dystocia is the impact of the baby's shoulder underneath the pubic bones, and that can happen even if your baby is not big. But people with gestational diabetes or diabetes which with uncontrolled sugar, because again, if you have gestational diabetes but your sugar are controlled,
Mm-hmm.
then you don't have any more problem. So your baby will grow normally because your sugar are controlled
Mm-hmm.
and they're normal. And so the people with uncontrolled sugar, they have bigger baby, and the fat around the baby is mostly around the
Mm-hmm.
chest and the tummy. So that's
Yeah.
why they will impact the shoulder.
Uh-huh. And do you work with bigger babies, say women with bigger babies or
Well, yeah, yeah, but lots of babies are born
yeah.
normally and they're big. It's
Yeah.
not necessarily a problem.
Uh-huh. And
And
you have
the
ways to
induction, yeah, and there's, shoulder dystocia doesn't happen that often to
yeah.
bigger baby that we have to do something about that. That was the outcome of the study.
Mm.
Um, so, you know, we
Yeah.
had a
It's all
home
very
birth
interesting.
the other day we had a home birth, and it was a second baby, and she was taking a bit longer to go. She was coming in and out of labor for a longer period of time, and we thought, oh, that's unusual because it's a second baby. Normally with second baby things start and then finish quite quickly, and then she had the baby maybe 12 hours later, and it was 4.7 kilos, and nothing happened, and everything was fine, and nobody expecting this big baby like that, and you know.
Oh, wow. This is so great. So she didn't know that she was going to have such a big baby.
No.
This
all
is,
the all the tool that we have to predict the baby's weight are not so the sympathy measurement is not evidence based, and the scans we have are unreliable. So when you have a scan, the numbers that they give you are more or less 10 or 20% plus or minus that
yeah. And
number.
then
That's
this,
a very big
yeah,
difference.
exactly.
Yeah.
And then it dictates how the birth goes because you're already planning whatever.
Obviously.
So
Yeah, yeah.
where do you see this unnecessary fear take? Like that is definitely one of those times, especially with type ones, you get scanned every month. And what about any other places where there's fear put into,
But
giving
fear, with the medical system just really like to
birth?
be based on fear, basically. And that's due to, their fear of litigation, and if there was a bad outcome about something, that they're going to implement guidelines for everybody because there was that bad outcome, and they try obviously to cover themselves, and so midwifery become a fear-based kind of practice because of that reason. But because they have this big number of people, and because they cannot guarantee a continuity of care, and they cannot guarantee this unique approach to the one person, so they do have to apply all the guidelines to everybody basically, because they don't have that continuity of
Yeah.
care. It's been shown to be so beneficial for a lot of things, including better outcome for mother and babies at birth, better experience, less needing to be to having intervention and all of that.
Yeah,
Yes,
and you
but
just become so much more powerful in your motherhood. You know, when the baby comes, if you give birth in your power, you just become so much more powerful.
yes,
I know
and
for
that's
myself.
what I really want people to experience in their birth. And sadly, birth is it's not seen as something like that.
No.
And that has been like a generational things for a long time now that we've been, you know,
Hmm.
they've been thinking
Programmed.
birth is going to be horrible, birth is going to be painful, birth is going to, I just want to get it done and hopefully everything will be fine. It's something that you're going to have to kind of
Endure
be come out somehow
life.
alive. Yeah, didn't want to say
Yeah,
that.
yeah, yeah.
Yeah,
It's
yeah.
like that.
Yeah,
So you have
absolutely.
to.
I was doing some antenatal classes and I always ask about what is your what is your goal for this birth and this pregnancy, especially for your birth. And this was an NHS class, and this person say, I just want me and myself, my baby to be alive. And that was her main goal. I'm like, this is how sad is that the people that that should be the bare minimum,
Yeah,
really.
it's just a
But that's it.
program. Yeah, we watch it on TV with all the films and everything. It looks bad. Yeah, it's so. But this litigation thing is because we hired private midwives because I have type 1, and so we hired private midwives, but we ended up having a hospital birth because he came early, and they took our private midwives to court. So we had to go to court when he was a few months old.
Course, yeah. And this even for us, I mean, as an independent midwife, that fear obviously is always there, and obviously we don't have the backup of the hospital and the NHS. So
Yeah,
if this happened to us, that's all on us,
yeah.
and that's really
Yeah, I
difficult.
mean, the outcome was good. My son was born perfectly, but yeah, they still ended up taking our private midwife to court. And it was actually her that saved, his shoulder dystocia because she said, lift your leg, Abby. And so it was like he came out, but if it was
Yeah.
just NHS, it would have been, yeah, cut or whatever. Okay, so to end this, round this up. So if your daughter had, or if you know someone, your friend or someone had type 1 diabetes and was giving birth tomorrow, what would you want her to know?
Well, hopefully, I would hope that she told me that she was pregnant before the day before her birth, so we can have a longer conversation. And pregnancy is this long because so you can think about all the things that you are going to think about, and focusing on your birth plan at 36 weeks is just way too late for that. So, what I encourage everybody is to start thinking about their experience as soon as they get pregnant, because that's all the time that you have to do that, and is the complete transformation that you're going to have, however or whatever is going to happen. You're going to be a different person, so
Yeah,
you have to really put if
yeah,
you want to learn about yourself, if you want to grow as a person, as a mother, as a woman, as a family, you'll have to think about a little bit more. And unfortunately, it's your responsibility to to look into this, because as well as the NHS work might be, it's still not enough.
yeah,
Um, so I would say to her, I think you have to you first of all think about what you want to do, because a lot of people likes to be told what to do and to be guided, and a lot of people trust the hospital or the doctor, a lot of people trust the midwife, a lot of people don't trust anybody, so they just want to do things on their own. So be really clear on what you want to do, what you want from this experience, and be honest with yourself about what you would like to happen, and talk to your partner as well about this, because you might be not really aligned, and that make things even more difficult. So once you make a plan together that is hopefully aligned with
yeah,
what you want to do together. And then you'll have to find a team for you that it works for what you want to do. And that might be, carry on with your NHS care and having your consultant there and making sure at least that you have the same one. I think most of the hospital have a diabetic team So you mostly see the same midwife or the same consultant. And for example, in our practice, in our NHS trust, we also have an endocrinologist within the team. So you speak to them as well. And if you don't like the approach, then find somebody else that you trust that can advocate for you and can, if you don't think that you can trust the hospital because you think, oh, they treat it like they treat everybody else. They're not seeing myself and my case as just one specific case, but they see me as everybody else. So then you will have to find somebody like an independent midwife or maybe a doula or somebody that you trust to help make this decision, because you're going to have to make difficult decision. And especially if you're booked with the NHS, they will want to talk to you about things, and you can always decline, but the way they talk doctors is a bit different from midwife, for example, and the way they talk in the hospital is a bit different how I would talk to people about risks and stuff. And so if you want to have a different view, then have somebody else by your side that can help you to do that. And then hopefully they have a good relationship so you can make a plan together for your birth, whatever that might be. But try to be open as well to, to things evolving as you go. So you can't make a plan for what is going to happen in 3 months because we don't know what is going to happen. So make sure you explore all the options and the scenarios, so then when things happens, you feel still safe, empowered by your choices, and that you can make choices coming from love, but not from fear. So I always say, when you make a plan for your birth, always focus on how you want to feel, not what you want to happen, because the things we can't control are very little. But especially in birth, even if you had 3 straightforward home births, the 4th one might be different. So you can never think, oh, things are going to go my way, because we have no control. Birth is such a mystery still, and we'd like it to be like that, really.
I love this way. This is like the way you talk is like it just like become conscious, like just open your eyes and see what's possible. I love this. It's so
Yeah, and then as things evolve, you make choices by that are dictated by what actually happens, because you might have planned to have a home birth and things have started there and they're going well. But for example, type 1 diabetes is a big thing, and the good thing is that you had it before, and so you're familiar with your body and with how your body works, and so the cues and yourself probably better than the midwife who is there caring for you, because you've been caring for yourself for such a long time with this condition. But it's a big, it's like going to run a marathon, if not even bigger. And so if you've never done that, if you've never run a marathon, you don't know how your body's going to react with that and diabetes. And there's lots of things that come into play during labor. The most important things that you allow your body to go into labor, and so that you remove all the fears, all the interference, so that your body, which already has some complexity, there is something else that it doesn't have to think about, like fear, for example, or feeling that you are held and feeling that you trust the people around you. So if you don't worry about that, then there is one less things to think for your body to do,
definitely.
and that is definitely going to make a difference. Even if it's a small difference, it's still a difference.
Fabulous. Thank you for this. Is there anything else you would like to share before we close? But that was really lovely. I love that. It's so true. And feeling the fear is so prevalent in a hospital. So I just recommend independent midwifery and to birth at home.
People do not expect that when you go to a booking appointment, even just like telling them your weight is going to trigger a lot of things if your weight is not in the right range.
Yeah, and we get that
So,
more with blood sugar. Oh, what's your blood sugar there? Ooh, what's your blood sugar? Ooh, it's just constant. It's like so a different level of fear with type 1. This is why I
of
work with type 1s.
Yeah.
Yeah.
But so pregnancy, I think, is a really, really good time in your life to think about yourself truly and to learn about your body. If you have not, if this is not within your practice already, just try to tune into your body and to your intuition and really go deep into this, because it's a great opportunity for a human being to discover so much about our amazing, miraculous body and what it can do, and how you're gonna be transformed, really. Because once you've given birth, again, it doesn't matter how you give birth. You're going through this rite of passage, and you're never the same.
Yeah.
And you go back and think, like, whenever something comes up and it's hard, you're going to think, like, I can do this because I've given birth to a child, a full human child. And I have been feeding this human child for a number of years, and I've been keeping this child alive. And
Yeah,
so I can do anything, really. And
exactly.
that's what I think every time I feel something is hard on my path. I'm like, giving birth twice.
I could do this. This is so
And all the people that I talk to, they're like, yeah, yeah, I do the same. That's what I think. But I also understand that sometimes birth might not be as empowering as it was for me, for example. And so that is why it's important. Even if it's your first baby, try not to think, oh, I'm just going to go with the flow, because at this time of midwifery, going with the flow doesn't go really
yeah, I totally.
flowing.
So,
No. And you don't want to have a traumatic experience for
right.
your second pregnancy, try to change that.
Yeah,
So birth is big.
yeah,
It's the first, somebody's birth is the birth, but
yes.
also as a mother is a big thing. So
We could go on and talk forever. Thank you so much. They really appreciate it. And I love all your wisdom, your consciousness. It's so lovely. And I wish you all the best with your private midwifery practice. And thank you again. And I wish everyone a calm and confident birth and journey. And thank you. Yeah. And so it's going to